So, thank you, Professor Larsen. I will try to explain something about osteopathy. As you see here, it's a drug-free, non-invasive manual medicine that focuses on the total body health by influencing the musculoskeletal framework, including joints, muscles, internal organs, and the nervous system. This is our ID, and its aim is to look at the body as a unit and positively affect all the regulatory systems. And it started all in the United States of America with Dr. Andrew Taylor Still. He was a founder of osteopathy with the aim of using manual hands-on techniques to improve circulation and correct altered biomechanics without the use of drugs. We are using the hands and, of course, the brain. The school, the Educational School of Osteopathy, started also in America. It was in Kirksville in the 1st of November 1892. And the special thing with that school is it permitted both women and African Americans to enroll in the classes. And that's special at that time. We also do have osteopathy in Europe. The first country in Europe was United Kingdom, and the first school of osteopathy was established in London in 1917 by John Martin Littlejohn. And he was a pupil at this university, at A.T. Still University. And then France. France was one of the earliest countries with osteopathy, and they have developed very important techniques for using this kind of medicine. And also Germany. Germany has a lot of schools, academies in osteopathy. And our neighbor country, Finland, as well, one school. And of course, Norway. So me and many of my colleagues here in America now, we have been participating in the teaching in the Norwegian School of Osteopathy. Osteopathic manual treatment in clinical research in Europe is not quite big, but in UK, the National Council of Osteopathic Research is responsible for the research. And I have to mention here British School of Osteopathy. I think this is one of the biggest schools with the most important research in Europe. And then we also have in Austria the Wiener School of Osteopathy. In Germany, Akademie für Osteopathie. And also Osteopathieschule Deutschland. And in Spain as well, Escola de Osteopatía de Barcelona. And now, also in Norway, we have the Nordic Osteopathic Research Institute called NORI. Some words about the Nordic Osteopathic Research Institute. This started with the development of a database. This happened over many years, and we do have a lot of research projects. And mainly we are working with multi-center studies. And we are using mainly Norwegian osteopathic researchers and students. And we do have seminars in Norway, Germany, and Poland. And some of the projects here connected to NORI, we have one with dose response of foot dysfunctions, one reliability, validity, and stability of the technology instrument Sakaido, and dose response study of low back pain, and OMT, as osteopathic manual treatment of gastroesophageal reflux disease, and then also effect of OMT techniques on patients suffering from GERD. It's the same disease, GERD, gastroesophageal reflux syndrome. And the last one here, anatomical consideration to anatomy of lower esophageal sphincter. So this was a very short report about osteopathy. So thank you for your attention. I hope there's no questions.
Well, if there is some question, please come with them. That was a short introduction to osteopathic medicine, and it turned out that the difference, the big difference between pharmacy, which we are using the classic school of medicine, and osteopathy is that the osteopaths, they are using their hands as the tablets instead of the tablets. But they have the same view, the same medical background, and seems to be not an alternative, but an addition to the way we are treating patients today. I am not an osteopath, but I have used osteopathy for myself, and I know how it works. So in several cases, that's very important. So Kjell, thank you for your short presentation, and here is your diploma.